Hi, I'm Ann Giles, Director of Coding and OASIS Review at PPS Plus Software, and here is your OASIS Tip of the Month. This month, we will be defining bedfast for OASIS purposes. M1850 transferring and M1860 ambulation report the patient's ability on the day of the assessment. The day of the assessment is defined as the 24 hours before the clinician arrives in the home and the time spent in the home performing the comprehensive assessment. Chapter 3 of the OASIS C Guidance Manual in the M1850 Response-Specific Instructions defines bedfast. Bedfast refers to being confined to the bed either per physician restriction or due to a patient's inability to tolerate being out of bed. If the patient can tolerate being out of bed, then the patient is not bedfast unless medically restricted to the bed. The patient is not required to be out of bed for any specific length of time. The assessing clinician must use clinical judgment when determining whether or not a patient can tolerate being out of bed. Let's take a look at a couple of examples. First, let's look at a severely deconditioned patient that is only able to tolerate being out of bed for a few minutes.